board certified plastic surgeon and specializing in body recontouring surgery. And this morning I was going to talk about a procedure for a pretty sensitive topic. This is something that a lot of patients are very embarrassed to be talking about, even in front of a physician. The procedure is called a labiaplasty. It's also known as vaginal recontouring or vaginal rejuvenation. And as I say, it's a pretty sensitive topic because it's a pretty sensitive spot. Women are very embarrassed about this. Now, the reasons to have this performed among my patients are essentially twofold. One is for symptom relief. Now, what this procedure involves is reduction of the labia minora, which are the two little flaps of tissue that hang down below the labia majora. And patients want the projection of these little flaps of tissue decreased or eliminated. They don't want to be able to see anything hanging down when they are without clothes and standing in front of a mirror or their partner or whatever. So one of the reasons that they come to me is because they just don't like the appearance. This is an aesthetic problem. The other reason is a more functional issue. These labia minora can get pinched when a woman is sitting down, especially on a bicycle seat or in tight clothing, such as the tight jeans that young ladies like to wear these days, or a bikini bottom or something like that. And it can get pinched and be very uncomfortable. So they want the projection of these, the labia minora, decreased. Now, as I say, the labia minora, these two little flaps, roughly triangular shape that hang down, you know, a generation ago, very few procedures of this type were being performed. The reason for that is women didn't really know what other women looked like. Well, now we have something called the internet, so there are no secrets anymore. This is a procedure that I am doing with greater frequency all the time. The way this is done is, historically was fairly simply. Mostly this was done by OBGYN surgeons, and they would simply amputate the distal end of the far end of the flap of tissue and just put some stitches in. There you go. Now we have a more elegant way to do this, and this is thanks to a physician by the name of Gary Alter. And it involves taking a wedge of tissue out and reapproximating the edges, which gives us a much better match with the color and the texture of the resulting labia, which is smaller and tucked in. This is the technique that I think that most surgeons who are performing labiaplasty are performing nowadays. And you can go online at the internet and you can actually, I'm sure you can find a place that you can see these operations performed. It's called the Alter wedge excision. And that's the procedure that I perform. And now I do this a little differently than a lot of surgeons. I do this under general anesthesia. I can't imagine anybody wanting to have this done under local. You'd have to have needles, and that's a very sensitive area. But it's not a very demanding procedure. It takes about an hour, another half hour in the recovery room, and then patients go home. Post-op recovery is fairly easy. It's typically like you would be treated if you were delivering a child. The way the obstetrician treats their patients. It's just no real physical restrictions. It's a little uncomfortable for a day or two. We give you pain medicine for that. But by 5 days later, when the patients come back to see me, they're really back doing everything they were doing before. And since I put in dissolving stitches, you don't have to have your stitches out. So it's really just it's really not something that you really need to be embarrassed about, because we see these all the time now. So if you're having trouble with either the appearance or the functionality down there, give us a call, drbartel.com or 608-271-0500, and I'd be happy to talk about the procedure with you and show you numerous before and after pictures so you can actually see what you're going to look like. So that's basically that. I just wanted to put in a plug for one of my favorite pastimes. We just got back last night from Spring Green, where we enjoy watching a Shakespeare show at American Players Theater. We saw Measure for Measure, wonderful show. These are terrific actors. These are a professional troupe. It's a beautiful location. It's outside. And we've, in 25 years that we've been going, we've never been rained out. And it was a beautiful evening in what we call the Enchanted Valley last night. I encourage anyone who has any interest in theater, check it out. So that's it for today. We'll talk to you next week.